Hi, I'm Akram. Please welcome to IAN's Health Talk with Dr. Akram. Every 100 years, we've been hit with a pandemic. Is it nature's cause or human failure? 1720, the plague pandemic. 1820, the cholera pandemic. 1920, the Spanish flu pandemic. And 2020, the COVID-19 or coronavirus. 1720, Marseille, France. A ship landed with infected plague victims. Within the week, the infection spread around the village. Within a year, the whole Marseille and around been infected with plague and 100,000 people died. 40% of the population has been perished. 1820 in India. In a small village called Jessore in Lower Ganges, the infection started, the cholera. The devotees of Hindu religion were returning from Kumbh Mela, an Indian festival, and they took the disease and spread it around the villages. Of course, the British military placed in India moved around the world taking the disease. In a year or two, 100,000 people died. The infection being caused by Vibrio cholera, a bacterium again. But the deadliest of all was the Spanish flu. It happened during the First World War. It started in a place called Etaples in France. The British battalion was placed there. About 100,000 soldiers moved in and out of the place. They were animals, they were pigs, they were ducks to feed the military. The best place for the infection to spread. 500 million people being infected. In the end, 100 million died. And we are facing the COVID-19 or corona. Started in Wuhan province in China. Within 1 or 2 months, it spread all around the world. The country's been locked. Cities been closed. Airports are shut. Flights are landed. The economy is going down. Who is the culprit? Who is the terrorist this time? It's a small virus called coronavirus. Today, 22nd of March 2020, when this program being recorded, we've been looking at the deadliest disease which is spreading around our world, and it counts. There are 340,000 people been carrying this infection or identified with coronavirus or COVID-19. 14,500 people are dead so far, and 97,000 people had recovered from the disease. When I look at the chart of death and the infections being spreading around the countries, China has reported 81,000 cases. Out of them, 3,200 had died. Italy, where the most deadliest virus spreading, 59,000 cases being identified and 5,500 deaths. When I wrote this program yesterday and to today, just before the recording, I had to change it because the death number has increased by 1,000 around the world. UK So far, we're behind Italy. We have 5,500 identified cases and 281 deaths. Mortality for COVID-19 is 2 to 3% for people who are under the age of 60, but it's for 15% for people who are above 60. Out of the dead, it's 80% of them were above 60 with coexisting medical conditions like diabetes, hypertension, or immune deficiency. And 20% of them were young people under 60. Why do you think this disease is deadly? Because it spread fast. There are so many diseases which are more deadlier than this. If you've been bitten by a rabid dog, you have a 100% chance of dying. There is no treatment for that. Ebola killed 60% of its victims, and even avian flu killed 60% of its victims. What about the plague? Even if we have medicine, still 60% of the people die. Will this disease kill millions like other pandemics, or our modern medicine will halt its progress? So far, we don't have a medicine. The vaccine will not be ready till late next year, but we can prevent spread of the disease. Actually, these viruses have been living around this world for a long time. There was one of them been living around for about 55 million years ago, probably before the human species came to this world. And there is another evidence of being identified about 8,000 BC. But it was first probably identified under microscope in 1950s or 60s. These are basically kind of RNA viruses. A kind of genetic information is enveloped by a lipid bilayer. They are very simple organisms. But what is this COVID-19? COVID-19, basically all these coronaviruses, they've been living in animals for a long time. They sometimes they cause respiratory tract infections or kind of diarrheas on animals. But this COVID-19 basically, which has been living in bats for a long time, then at some point they would have jumped to pangolins, then afterwards from pangolins it would have mutated a bit of its genetics and started attacking human. And what kind of symptoms? Is basically these viruses cause flu-like symptoms. So someone who is infected with it could have fever, sore throat, cough, runny nose. Rarely people get respiratory distress or pneumonia. And occasionally it's been said that some people have been identified with diarrhea. Basically, it's spread by droplets. When someone sneezes or coughs, the droplets can travel up to about a meter or two. These droplets can stay in surfaces, like if somebody coughed on a metal place, that can stay for a while there. Or if someone coughs in their hand, then you go and shake their hand, you get the infection from them. But then if you touch your face, like your mouth, your nose, or your eyes, these viruses can log into your body and it'll cause infection. How to avoid it? So basically, as I said, because you know how it gets spread. So if you could prevent touching these droplets, you will basically protect yourself from the infection. It does not pass through the air. It's not aerosolized, and it doesn't go to your lungs with air. So wearing masks to protect yourself at this point does not help much for general people. I'll come to the point later. But how to avoid this infection? Basically, what we advise, and the NHS and the government advise at the moment, to stay at home. Don't go unnecessarily outside. Avoid big gatherings. Wash your hands frequently with soap and water, and or with alcohol gel. And you should have precautions dealing with people who has got coronavirus. If someone has coronavirus, it is okay for them to wear a mask, because when they cough, the droplets would not travel so far and it will not infect the other people. But the most of it is you should boost your immunity, because in the end, it's your immunity is going to fight this organism. There is no medicine for this, so you have to, your body has to fight it. So eat healthy, take good rest, sleep well, stay out of stress, and I think even reducing alcohol and stop smoking will help at some point. Hand washing. Why is hand washing important? As I said, this virus is basically a genetic information which is enveloped by lipid bilayer. It's basically, if you think a microchip is covered with kind of a thin wax layer. If you put this one in water, it will not dissolve. But if you put soap on it, it will dissolve, because the lipid will dissolve in soap. Then this genetic material of this virus is vulnerable and the virus will die. And who is at risk of this infection? Everybody is at risk. 80% of the population will get the disease, but most of us will survive with it. It will be like a small flu. Rarely, people above 60 with coexisting medical conditions or immunodeficiency, they can contract a deadly form of disease with respiratory distress and pneumonia. This is a killer. If you end up in intensive care unit, if you've been ventilated, your chance of survival is 50%. That's why there is a lot of deaths in Italy. How to avoid it? Again, stop large gatherings, keep away from it. I'll see you after a quick break.